and here.
Goodness. All right.
What did you think of that?
That was good.
And let's have you reach down, touch your toes. And how's that feel?
Good.
Good.
Yeah, it's better. It's not pulling nearly as much.
And we'll have you bend backwards as far as you can. Oh, no, that's much better than you were doing before. Okay.
That already feels way better.
Good. So I noticed that you said you've had some low back pain, and you're even having like some numbness and tingling in your leg. Okay, so tell me about everything.
So I had an accident in massage school.
Okay.
Where my horse tripped, and we ended up taking a tumble.
Yeah.
So my whole back was just jacked up, and I don't think I ever fully recovered from that. But it stopped hurting, life went on.
Right.
It's been, what, like 8 years?
Yeah.
So I want to say it's chronic. But anyways, 2 weeks ago, I decided I was going to try and lift a washer. That didn't work out.
Didn't go well?
No,
Okay.
no, you know when you're supposed to lift your legs, not your back?
Yeah.
Yeah. So I felt it pull in the low back, and we stopped. Poor husband, he's like trying to figure this out on his own.
Yeah.
But after that, I mean, severe, debilitating pain. I couldn't lay down, I couldn't sit, I couldn't stand. There was no comfortable position. Nothing was going to work. Painkillers didn't touch it. I went to the emergency room the next day. They gave me a muscle relaxer, prednisone, and naproxen.
Yeah.
For, I guess, the steroid to help with anti-inflammatory, and then the muscle relaxer, but it just wasn't very, I don't know.
Yeah.
It worked, but it didn't work. But I was in, like, pain the whole time.
Right.
I mean, I took the painkillers mainly to go to sleep at night, but even so, sleeping sucked. In the mornings when I get out of bed, it hurts. So because I have a 9-month-old, so when I go in to grab her, I have to like psych myself up to pick her up out of her crib because leaning over hurts so bad.
Right.
So it's
Okay.
very, it's mainly my low back, and I feel it on my right side, and it's like bulging out or something.
Okay. That's how it feels to you?
Yeah.
Do you feel it under your hand, or that's how it feels in your low back?
There's like something there. You know, like the.
So can you show me right where you feel it?
Yeah. It is. It's right here.
Okay.
And yeah, there's something there sticking out.
And is it going down your leg right now?
No.
Okay.
It will, if I turn certain ways. Like I was sitting in a car, and if I went to go crack my neck, and I did this number, and I could feel it in my low back.
In your low back and in your leg?
Mm-hmm.
Okay.
Yeah, but it'll only if I start to jack with it does it start to go down
Act
the leg.
up.
Yeah.
Okay, gotcha.
But,
So let's see kind of how well you're moving,
Okay.
and then we'll kind of take a look at your spine and we'll go from there. So we'll have you stand right here, and then you'll face towards the door.
Okay.
Let's have you reach down and touch your toes as far as you can. And does that increase the pain at all?
I can feel it.
Okay. And
I
then
don't know. I feel like I've been living with this pain
for so long, right?
I mean, it's definitely there. There's a pull.
Okay.
It's not on the left side though.
On the right. Let's have you lean backwards as far as you can. Okay. And then face towards me, and we're going to lean to the left, lean to the right. Does that make it worse leaning this way? Okay.
No.
And then if we come back like this, doesn't make it any worse? It's not happy about it?
Right.
Okay.
Not like,
Gotcha. So let's have you lay face down. Your face will go right here where the paper is, and then there's a little handle that you can place your hands and your wrists on. Perfect. And then let's scoot you down just a hair. There we go. Okay. So, yeah. That doesn't feel super happy with you.
no.
And then if I come in right here, is that painful there?
Not painful, just pressure.
Okay. And then what about here?
Just pressure.
Just pressure. Okay. But up in here?
Oh yeah.
Okay.
Oh yeah.
Have you been to a chiropractor before?
Yeah, a long time ago.
Okay. And did that help when you went? I know it wasn't for the same thing, but
Wherever you just were.
right down here.
Yes.
Okay.
That.
Yeah, so your QL feels very upset. Okay. Yeah. So we're going to use a little bit of massage gun in here, and then we'll work on that muscle for a little bit.
Okay.
Doing okay?
Yeah, it tickles.
Okay. All right.
How was chiropractic school?
Oh my gosh. Long. Yeah. So I had to go back and finish my undergrad because I didn't finish in undergrad attempt number 1. And so I had to go back for about 2 years to finish my undergrad, and then chiropractic school is almost 4 years long. It's about 3.5 years long. So yeah, a lot of people don't know that it's 7.5, 8 years long, and a lot of people also don't know that it's like a doctorate level type.
Absolutely.
So, but it was quite the journey. I'm very thankful that it is over.
Oh, I'm sure. Yeah.
But it was fun.
While I was finishing my prereqs, I did massage therapy, and then so I learned a lot. But my end goal was not massage therapy.
Right. What's
So,
cool about massage is it does make a really good part-time job.
yes.
And it provided for me all through grad school. It provided for me, after undergrad and stuff. And you can use it as a springboard to all kinds of things. And the experience with hands-on working on bodies was really applicable to chiropractic.
Oh, yeah. And your tactile senses.
Yeah. Initially, it was a little hard to switch my mind from working on muscles to working on joints and feeling the bones in the joints.
Mm-hmm.
But after a while, I was very thankful for it because it helps you figure out, exactly how to work with somebody, make sure they're comfortable.
Yeah, it was cool. I got a little bit of an advantage in hiking school, and when you have to feel like down below the gum line where you can't see, you have to use your tactile senses. And so I had a little bit of an advantage when it came to my class.
Is there any tenderness in here?
No, not tender.
Not really.
But it's like if you were to push harder, it wouldn't be tender. It's more like that's really like tight kind of thing.
Gotcha.
Like I haven't had a massage in a long time. I feel like we're the worst patients.
Well, massage therapists, chiropractors, we're sometimes the worst about actually taking care of ourselves and getting body work to take care of us.
Dentist and dental hygienist the same.
Yeah. Okay. So let's.
That is starting to, from the left side, it is starting to spread more of the middle.
Okay. So let's have you lay on your side. You're going to face me over here.
Oh.
You okay?
Yeah. Just hurts.
I'm going to lift this up. Okay. So your bottom leg will be straight. Your top leg is going to be bent.
Okay.
Perfect. Okay, I'm going to pull you off this shoulder here. Good, and right here. Okay. I'm going to give you a little bit of a twist here.
Okay.
Is that okay?
Mm-hmm.
All right. So, deep breath in, out. Let your belly be loose. Good. There we go. Okay. Good release there, and then let's roll over to the other side. How'd that feel?
Good.
Good.
I'm hoping this side's going to be.
Just as good. We'll go here. Okay. And right here. Just like that. Okay, same thing. I'm going to give you a little twist here. Good. Okay. And relax as much as you can.
Oh, yes.
Good. Felt good?
Look, I needed that.
Yeah. We're going to try one more here for your tailbone. So we're going to go similar type setup.
Okay.
Okay, we're going to be right here. So, nice and easy. Good. There we go. Okay, a little bit through that hip. Now,
Can your tailbone really be out of place?
not so much out of place as it just gets jammed up. So, have you ever jammed your finger or something catching a basketball?
I tried to do an inversion table, right? And when I went upside down and relaxed to feel everything opening up, it almost took your breath away.
Yeah, it can be a lot, especially because on an inversion table you're dealing with your whole body weight, right? So it's you're suspending all of you from the area.
And then when I would come back up, it was recompress, almost pinching something. So I stopped doing that because
if you're not getting the result you want from it, just bail on it.
Gotcha.
But But yeah, it doesn't really go out of place so much as the joint almost like shears and locks up. It kind of gets jammed up the way you would jam a finger. And so
Okay.
what we do is we go in there and we put motion back into the joint so it glides smoothly.
Okay.
And that helps the muscles calm down, helps with the inflammation. Sometimes if the nerves in the area are irritated, that calms the nerves down.
Gotcha.
And that gives you like a nice window where you can be more active, move better, feel better, and have less pain.
Gotcha.
So let's have you scoot down a little bit. Good. Okay, so we're gonna go into your mid back here.
Okay.
Cross your arms. Good. I'll roll you a little bit. Okay. So breathe in, out. Good. Let your shoulders relax.
Yep, heard that.
Yeah. We go a little lower. Perfect. Breathe in, out. Good. How's that?
Good.
Okay, and then we'll take a look at your neck, okay?
Okay.
So let's have you slide on up here. Perfect. A little bit right here. So, nice and easy. Good.
Good.
Okay. And here.
Goodness. All right.
What do you think of that?
That was good.
Good.
That was good.
All right, we're going to give you a little pull here.
Okay.
Breathe in, out. Good. A little decompression.
Yes, that was awesome.
Okay.
That's what they would normally do, like when they would like wrap that thing around your head and pull it.
Oh yeah, the towel pull.
Uh-huh.
Yeah.
It's like
There's the guy in Houston, Dr. Gregory Johnson, calls it the ring dinger. Yeah.
Yeah, that probably works. I felt that. That was good though.
Yeah. Okay, so let's have you stand up and we'll take a look at some of those movements and see how they feel. So we'll go back right here and you'll face this way. And let's have you reach down, touch your toes. And how's that feel?
Good.
Good.
Yeah, it's better. It's
What?
not pulling nearly as much.
And we'll have you bend backwards as far as you can. Oh no, that's much better than you were doing before. Okay.
That already feels way better.
Good. And then we'll go tilt this way and the other way. Cool.
Yeah, and it doesn't hurt. Like when I engage my core to come back up, I feel it, but it's not like sharp, debilitating pain.
Yeah. Good. And so like the goal is that we'll help kind of calm down the muscles
Okay.
and reestablish smooth motion in that joint.
Good.
It'll help reduce the inflammation, reduce your pain, and it should help keep those leg symptoms from coming back. I know you're not having them right now.
Right. All right. Well,
All
thank
right.
you.
Yeah,
I
you're so
really
welcome. It was
appreciate
good to
it.
see you again.